Here's your heart. This is how it works. Let's go. What's up, everyone? Mike Muellner here. I'm an internal medicine doctor from Los Angeles, California, and today we're going to talk about how the human heart works. So the heart, as we all know, is the organ in the body that pumps blood. But how big is it? Where exactly is it located? What are some of the specifics here? So for most adult humans, the heart is slightly larger than an enclosed fist. It's but a little bit smaller than two fists combined, unless it's a diseased heart, in which case you can get a dilated cardiomyopathy where the heart's a little bit larger. That might be about like two fists. But for most people, the heart is just a little bit bigger than an enclosed fist. So it's about like, I guess this model is pretty good at approximating the size of the heart. Now, the structure of the heart, it's comprised of four chambers. Two small chambers on the top. Let's see if I can pry this open. Two of the small chambers, these are the atria, and then the two larger chambers below, they're called the ventricles. So four chambers in the heart, the size just slightly larger than an enclosed fist. Now, where is it located? Well, in the chest, but it's oriented in such a way that's in the chest, but a little bit on the left side. So the left side of the chest. Some people can have a condition called dextrocardia where it's actually reversed. It's on the right side. But that's pretty rare. For most of us, it's located just to the left of the center of the chest. Now, back to the structure of the heart. So we went over the four chambers, the atria and the ventricles. The atria are quite small. They're the small chambers on the top, and all they really do is they load blood into the larger chambers, the ventricles, which have a lot more of the pumping power. The ventricles pump blood a lot more forcefully. So you can consider the heart as being the atria on the top, ventricles on the bottom, but I think it makes a lot more sense to divide the heart functionally into the left side and the right side. The right side of the heart receives blood returning from the rest of the body, and it pumps blood through the lungs. So not around the whole body, but rather the lungs, where the blood is oxygenated and then loaded into the left side, first into the left atrium, then into the left ventricle. Now, the left ventricle, this is where the magic happens. This is the largest, strongest part of the heart that pumps the blood into the aorta, where the blood ends up going all throughout the whole body, up to the brain, down the arms, down to the stomach area, the abdomen, all the way down to the lower extremities, all to the tips of the feet. That's all thanks to the left side of the heart, the ventricle, pumping very forcefully. Now, this whole thing has to work like a well-oiled machine with all parts interacting in just the right rhythm, just the right orientation. And so what happens here is you have an electrical conduction system. This starts at the sinoatrial node. Electrical impulses go down the heart in this angle, causing each part of the heart to contract in the right sequence to most efficiently pump blood. Now, what keeps the blood moving forward? We got all these different chambers. Well, for that, we have valves. So there are, just like there are four heart chambers, there are four valves. You have the tricuspid valve, which lies between the right atrium and the right ventricle. Then the pulmonic valve, which is in between the right ventricle and the pulmonary arteries in the lungs. Then there's the mitral valve, which goes from the left atrium into the left ventricle. And finally, the aortic valve from the left atrium into the aorta, where blood passes through to reach the rest of the body. Now, with such a complex organ, you can bet a variety of things can go wrong with this. So one issue is what we call cardiomyopathy. That's where the heart muscle becomes weak. Lots of things can do this. A very common cause is coronary artery disease. That's where we get blockages in the coronary arteries, which are the arteries supplying blood to the heart muscle itself. This can damage the heart muscle and then make it much weaker. We can measure this with an echocardiogram. That's an ultrasound of the heart. And specifically, the measurement is the left ventricular ejection fraction. Normal heart can squeeze out about 60% of the blood in the ventricle with every beat. But a diseased heart can only do much less, maybe 30%, even 15%, or even less. And so that's a cardiomyopathy. Other things that can cause the heart muscle to be weak are drug use, alcohol use. These are some other common causes. Another issue you can run into is problems with the heart valves. So leaking heart valves or narrowed heart valves. A common one is the aortic valve. So the valve that goes in between the left ventricle and the aorta. Over time, this valve can become narrowed, which makes it very hard for the heart to pump blood through the valve. It can also leak as well. And so you can hear that, oftentimes pick it up with a murmur. It makes a whooshing sound when you listen to the heart. That's one of the things that doctors are listening to when they listen to the chest. And for this one, if the valve gets really bad, unfortunately, there's not really any medications you can take that will fix it. Ultimately, people need to have the valve replaced. In addition to weak heart muscle or bad valves, you can also have problems with the electrical conduction system. This leads to arrhythmias. Common arrhythmias that we see, one of them is atrial fibrillation. That's where the small part of the heart fibrillates or just vibrates out of control. And this then increases risk of stroke because blood pools in the area, can form clots. Clots can go to the brain. It also can cause the rest of the heart to pump too fast. Normal resting heart rate should, in most people, be less than 100 beats per minute. Someone with atrial fibrillation, it can run 130, 140, 150 beats per minute. And this can be very uncomfortable. It causes palpitations. It compromises the efficiency with which the heart can pump blood and can even cause a lot of problems. Problems like fainting, chest pain, shortness of breath, or even just having the rapid heart rate itself over time can weaken heart muscle too. We call this a tachycardia-induced cardiomyopathy. Now, we are not done. Far from it. There's many other things that can go wrong with the heart. Another big one, we touched on this earlier, is coronary artery disease. So even though the heart is an organ that pumps blood to all the other organs in the body, providing oxygen and nourishment, the heart itself needs its own blood supply, and it gets that through the coronary arteries. Over time, these can become diseased. They can get narrowed. You can even get blockages. The worst case scenario is you can form atherosclerotic plaques. These are cholesterol plaques. And then these plaques can rupture, causing near complete or even complete blockages of very important coronary arteries. And when this happens, we call this a type 1 myocardial infarction, otherwise known as a heart attack. Then moving on, another big issue you can get with the heart is something we call congestive heart failure. So this is when the heart muscle becomes weak or for whatever reason just can't pump blood efficiently anymore, and that causes backup of blood into the pulmonary vasculature in the lungs. This can then cause fluid to build up in the lungs, making it very hard to breathe. It can even back up into the liver and even into the lower extremities, causing swelling in the legs. But even worse, what happens is that the heart no longer pumps blood efficiently, and then the kidneys detect this as lower perfusion of the kidneys. That then causes the kidneys to retain fluid because the kidneys think that the body must be dehydrated if it's not getting enough blood. And then so the kidneys do what they're designed to do, which is to compensate for that by retaining fluid. The problem then is that the more fluid you get, the more overloaded the heart becomes, and it makes it even harder for the heart to pump blood. So it's this vicious cycle that leads to the whole body swelling up, fluid collecting in the lungs, and it can be quite dangerous. It can even be fatal. Now, there are many medications we use to treat heart failure. A big one is diuretics. So furosemide is an example of this. This tries to break the cycle by forcing the kidneys to get rid of fluid, making it easier for the heart to pump. Okay, congratulations. You made it to the end of the video. You're all cardiologists in my book. So okay, just kidding. Even I'm not a cardiologist. I'm an internal medicine doctor. I would have to do 3 more years of fellowship training in order to become a cardiologist, and 1 to 2 additional years if I wanted to become an interventional cardiologist or an electrophysiologist. So it's a complicated organ, and people can spend literal decades studying it. But I hope you found this video to be helpful in some way, at least as a good introduction to the way the heart works and some common issues that can arise. If you would like to see more medical videos or other medical content, here's another video you can check out there. And if you feel so inclined, go ahead and hit the subscribe button there. I would really appreciate it. And I will see you guys next time.